Professor Anthony Pereira now joins me from London. He's the director of the Brazil Institute at King's College London. Professor, good to have you on the program. The mayor of Sao Paulo warns that the city's health system could collapse. This is the country's largest city, with hospitals expected to run out of space in 2 weeks. What's the health care situation like in Brazil, and how critical of a situation is this that we're seeing there?
I think it's a critical situation in Brazil. It's hard to generalize because the local variation is very great. São Luís in Maranhão, for example, has had a pretty strict lockdown imposed judicially. So there are some places where capacity is pretty much at its limit and other places where it's not. But I think what you're seeing is confusion and tension between different levels of government, partly because President Bolsonaro, has been fighting his own health ministers. So he's lost a health minister last month, and he lost another one last Friday because he disagrees with the advice of these health ministers to maintain the lockdown, to maintain social distancing. And he's very much against those measures, and that's creating, I think, some uncertainty amongst people. And it helps explain why the adherence to the rules that are coming down from the governors and the mayors is only partial. It's only been about half the population that's been respecting those orders to not to aggregate and not to socialize.
Mm-hmm. And that's what I wanted to ask you, because Brazil is now the fourth highest, the country with the fourth highest number of coronavirus infections globally. But as we know, the real number is probably much higher because health experts are saying there isn't enough testing being done. But we are seeing a number of cities do lockdowns. There is this call to socially distance and wear masks. But as you said, a lot of people aren't following it. So why is Brazil so far behind the curve compared to other countries?
Well, I think it's a combination of factors. Brazil moved pretty quickly. It moved to start imposing lockdowns in mid-March, when it didn't have that many cases. So it was promising the way it moved initially. But I think, as in many other countries, the pandemic exposes inequalities. So there are many people in Brazil who try to work every day to get cash to pay for food, and it's very difficult for them to isolate themselves all day in their homes. They run out of food, so imposing the lockdown was quite difficult. And of course, as I mentioned, the president has been skeptical from the beginning of the effectiveness of general lockdowns, and has been urging people to continue to work, and he's been blaming the governors and the mayors who are imposing lockdowns. The Supreme Court upheld the principle that decisions on public health are the responsibility of local authorities. So he doesn't have legal authority to override these lockdowns, but he's, as an example, as someone who's going out and mingling with people and saying that the economy has to take precedence over the public health crisis, he is influencing people and causing some confusion, I think, amongst people about exactly what to do.
Yeah, how dangerous is that, where you have the mixed messaging with some governors imposing lockdowns in their cities and people being told to wear masks, but then you have the president himself saying, oh no, this is just the little flu, and going out and attending these lockdown rallies and not wearing a mask himself. I mean, how dangerous is that for people to see that example coming from the president?
I think it is dangerous. It creates confusion, and it risks jeopardizing all the good work that was done early on when the lockdowns were imposed before a lot of cases were reported, and it risks secondary surges and then the health system getting overwhelmed. I sense too that it's created some consternation regionally. So the governments of Chile and Argentina and other countries in the region are looking at the fact that two health ministers in a row now have been undermined by the president and have either been fired or quit, essentially the same thing in the end. And there's still there's an interim health minister, but nobody been appointed in his place. And they're worried about the regional effect of this, because that could spread the virus throughout South America, and the cases in those other countries, the number of cases now is much lower. So it's a regional issue as well as a domestic issue in Brazil.
Okay, we're going to leave it there. Professor Anthony Pereira, thank you.